To day 12 of our psychology training. We have studied everything related to workplace psychology or kind of stuff like counseling psychology. Or now we are going to talk about a more deeper sensitive topic, which is trauma informed care. Okay, so now whenever you are getting involved in counseling processes or therapeutic process, if you are working as any mental health professional, so you have to deal with people who are dealing with trauma. Okay, so people with trauma are a different kind of people. Okay, now whatever we have studied till now is not somewhere is not going to help. Okay, yeah, it is going to help, but not actually. Why? Because it is a very sensitive topic where we have to, if required, we have to leave all our study, all our knowledge behind and help the person to feel safe and get involved with us. Okay, so getting it, obviously your knowledge is going to help you, but at the same time, if we are working with person with trauma, so we have to very sensitive about the issue, and we have to very conservative, we have to very we just have to be a person who can be trusted fully, and we have to be very safe person, we have to be very comfortable person at the same time. Okay, so while doing that thing, sometimes it is not required to getting stuck with your knowledge or with getting stuck with anything, because now trauma informed care is very different kind of thing. Okay, what trauma is, trauma reshape person's mind and body. Okay, how body, the person like not sleeping well, he is having trouble doing a lot of things. Okay, so now his health can degenerate at very worst. At the same time, the mind is now not very active and now not very engaged in activities. Okay, so trauma, first thing, trauma, what trauma is. Okay, so it shifts persons. If any moment which is felt very traumatic to a person, it is subjective thing to feel. Okay, so whatever, like there are stuff like people think nothing about it, but if someone get affected, okay, at a mental level, so yeah, it is a trauma for him. Okay, trauma could be anything: seeing someone fight, seeing some blood stains, seeing something which is very wrong in society, like experiencing something. Okay, so it could be experience something, it is knowing something, and it is seeing something. It could be any kind of trauma it is. Okay, like listening to someone something could be very traumatic for someone. Okay, so what trauma is, it doesn't care about what's wrong in it. It is just happened. Okay, it have problem with what happened. Okay, whatever has happened is like now affecting. Okay, so now all our thing like cognitive functioning and stuff like cognitive restructuring are not going to help now, because the person can't deal with what happened. Okay, and the thing is, it has happened, or it is a thing, something which is not going to change, but now the person is in trauma and it is affecting it a lot. Okay, so now the only way through is like helping the person through safety and empowerment. Okay, we just have to empower that person to understand, yeah, okay, if it has happened, it is okay, now I can do it. Okay, I can go through it. That is the only goal which we have. Okay, we just have to empower that person, and we just have to like feel the person very safely. Okay, the person should feel very safe. Why? Now the person is feeling unsafe in his body only. Okay, now if there's trauma, so yeah, we have seen like childhood trauma and stuff can like help that person in another way. Like the person, if there's a childhood trauma, now he is having problem doing these things. Yeah, if in like CBT also, if we like if we are finding the core belief and it is associated with trauma, now our focus shift to very sensitive. Okay, now we are not very like, now our focus shift from not from like cognitive restructuring and stuff, we bring to like safety in the thing. Okay, we are very conscious with our doings, whatever we are doing. Okay, so now what trauma is? Trauma is overwhelming experience. A person, whatever he is experienced is very overwhelming. He could listen to something, he heard something, he's seen something, or whatever the thing is. Okay, but trauma is what? Is it an overwhelming experience? Type of trauma, it could be acute, it will be chronic, it could be complex, it could be developmental trauma, could be there which is developing day by day, or it could be trauma associated with the person's childhood or something. So yeah, so it could be acute, chronic, complex, wherever we could not understand what had happened. Okay, the person could not like figure out what has happened with him, and now it is very complicated to deal with that stuff also. Okay, if there are victims of some crime, some heinous crime, so they just have very complex kind of trauma where they just can't explain what has happened. Okay, if the criminal is very dear to them, now that is very complex trauma. Okay, so now there are many kind of trauma, which is acute, chronic where their body gets shattered, where they have like if there are going to be some if they are victim of some kind of heinous crime, and they have burned a mark or some kind of marks which is going to be stay on their body, so it can be a very chronic trauma at the same time. Okay, impact safety, trust and self. It impacts someone's safety. Okay, now the person don't feel safe. Okay, now the person don't trust anyone, or now the person not even self-aware. Okay, so understand what trauma is doing with a person. Okay, if there's trauma, the person don't know who he is, what he is doing, what has happened. Okay, he know everything what has happened, but what has happened, how could it happen, complexity is there. Okay, now the person is not motivated. Like we don't talk about normal things. Okay, we can't talk about normal things or normalizing things, because it is not very shallow which we can understand and restructure. It is very deeper which the person could not get healed if he is not feeling safe. What are the sign of trauma which a person can show? Flashback of that moment. Okay, PTSD, there are cases of PTSD where they get flashback and they get panicked at a moment. Okay, or they get numb, very numb. Okay, they are not feeling anything, they are not seeing anything, they are not understanding anything. So there can be numbness, or there can be hypervigilance at the same time. Okay, these are the signs of trauma. Sleep, memory and physical health issues. Okay, the person's memory is very affected, like he don't understand what is going through, okay, his mind. So now he is very in like he's having flashbacks of something. So now that flashback in his memory capacity are not ready to encode any other information. Okay, because of that flashbacks and because of that traumatic experience, he can't encode something, or if he is encoding something unconsciously, still cannot recall it. Okay, if something get like he is listening to some stuff or something, so he can't recall what he has heard. Okay, why? Because there's a he's in a vicious circle where he is like getting stuck. Okay, sleep also, because at the same sleep time he is going to get overthink about it, he is getting flashbacks, and also sleep is going to affect, and duly the physical health issues will arise. Why? Because sleep is associated with very like n number of physical health issues which could happen if you are not feeling very healthy. Emotional dysregulation is there. Okay, withdrawals are there. Okay, emotional dysregulations, like the person cannot regulate his emotions directly, like he is feeling good, but at the same time if any flashback because of any kind of situations come, so now he is being claustrophobic. We can understand that person is feeling claustrophobic, but yeah, now the person is very panic. We can associate it like, yeah, he was very good, but then again he started behaving differently. Okay, he was very depressed then. Okay, he's not talking then. Yeah, because there's emotional dysregulation because of trauma, and at the same time withdrawals are there. The person involved in something and now that we withdraw because of safety concerns. Okay, we don't get involved with anything which is not ensuring our safety. If there's a ride which is there, okay, which is very good ride, but there's 0%, there are like 10% safety only. Okay, so now you will withdraw yourself. Now, same happened in milligrams obedience model where there was concern with safety, so they have to withdraw that thing. Okay, so similarly, the persons who is having trauma is having very conscious about his safety, so he withdraw himself a lot of time. Core principle dealing with trauma is just safety and trust. Okay, nothing is going to work, nothing logical explanation, nothing like because he is not in a state to listen, he is not in a state to understand things. He just want to feel safe, and that's it. He just want to trust you, that's it. Okay, because it is the most important thing, and it is the most the person can do. Okay, if a traumatic person could build trust, so that trust is very precious at first thing. Okay, and at the same time, it is a very, we have won the battle. Okay, if we have just bring trust in that person's life. Peer support and collaboration. Peers are there, that person understand. If the peers understand the problem and just bring out the thing that we understand what you have gone through. Okay, and it doesn't change you as a person for us. And if the peers are really genuine now, it is not required for them to do anything more than that. If your friends are very good, if a traumatic person have a very good friend, then yeah, it is very required. That is why we say person is a social animal. Okay, human are social animal, and it is required to maintain social identity, and society is very important. This is why which is important. Because of some trauma, yeah, there are the thing that whatever happening is happening in society by society, but still, if you get healed, there will be some person from society also. Okay, empowerment and cultural sensitivity is also required. If whatever kind of culture, if the person is affected due to culture, okay, or if we are dealing with that thing, so we have to understand that we are just with the person, not against any culture at the same time. Okay, this is which is required. Brain in trauma is like amygdala overactive, prefrontal cortex is prefrontal cortex is underactive. Okay, so what amygdala is responsible for? Emotional regulations. Okay, prefrontal cortex for planning and stuff. So planning and stuff will be very degenerative in the person, and the emotional regulation will be very high. So there will be so much of emotions, there will be so much of emotional irregularities which we can see in that persons. What techniques will help? Mindfulness will help, but only when the person is feeling safe. Okay, somatic work, breathing exercises, yoga, walks, they are going to help. Okay, soothing the person, massages, or at the same time massages help. But if the person is having some somatic experiences which are very bad, or which is very conscious about, the person is very conscious about that, then we don't do massages and stuff, we don't involve in it. Okay, support brain healing. Okay, so yeah, now CBT comes in a way, like neuroplasticity is there, so yeah, we can just use that aid of your brain. Okay, neuroplasticity, so support brain healing. Okay, brain if there's traumatic evidence is there, so now the person is withdrawing from an event, so now you understand there's another neural pathway is created, so we have to break that pathway. But at the same time, if the person feels safe, then we can understand that pathway is half broken. Okay, because now the person thinks the world is not a safe place or stuff like this. Okay, similarly, if we see acid attack victims in disability sector, there are another disability names categorized as acid attack victims, so we have to identify them, we have to include them, we have to empower them. Okay, so this is which is required. Then they understand that yeah, world is good place, we can roam around, we are not just limited to a room or somewhere. Okay, now when you are dealing with that person with trauma, so there is, with trauma you can get carried away, and you can involve in a vicarious trauma, and you can just stuck in some kind of trauma. Okay, which is very real, which could happen to anyone. So prioritize your wellness and support. Okay, don't get involved, but just don't get involved more emotionally and like fully emotionally. Okay, always have a objectivity and always have the observational point of view. Okay, don't just get very subjective with your case. Okay, though it could be very required, but yeah, if still you are bringing safety, bring with the objective point of view. Healthy providers help either. Okay, if you are involved in a case and you are dealing with a case, and then you just get stuck with trauma, with serious trauma, and now you can't help anyone else, but if you are healthy, you can help tons of people. Okay, so understand that. To conclude that informed trauma informed care is just empathy and empowerment from survival to thriving. And the only thing which is required is a build a safe healing centered space where person can get involved, can feel safe, and like still all the principles of like unbiasedness are there, cultural sensitivity are there, and everything which is required will be there. Okay, so that's all we can talk about trauma, because you know it is a sensitive topic. So that's all from my side. Now meet in next session.